So we here at Brunswick Fire Department are proud to serve the citizens of Brunswick 24 hours a day, 7 days a week. We have 4 crews that help provide the coverage for this rotation. So not only is this a workplace, but this is also partly considered our home, where we are here 24 hours around the clock for whatever your emergency needs are. If it's a fire, a medical, a car accident, when you call in your time of need, we're going to respond.
Medical emergency. Medical emergency. Medical emergency.
Brunswick Central Station copies, thank you. On this screen here, this is the normal screensaver screen, if you will, that shows the display of the map and the location of the apparatus. Once a call is received at dispatch and they go through their procedure, they send it across to us. That will then show on this computer screen with the address and the nature of the call. That will then trigger tones for either fire or EMS response, and they will come over the airwaves and dispatch us with further direction. The first thing that's going to happen when we get a call is we're going to hear the tone, and then we're going to go to our assigned truck. Once we get into the assigned truck, we would then look at our streetwise map that's going to tell us the information for the call in terms of where the address is. At the top, you'll see here that we have touch screen that will tell us what process we are at in the call. So right now it says available. If we are going on our way to the call, we would then hit en route, and then that would highlight, and then once we arrive on scene, an arrive on scene button will be displayed at the top. We press on that. That helps give us the timestamps that we need in order to correctly document all the paperwork to be accurate as far as when we responded, when we arrived on scene, and then in the case of being on an ambulance, you would say then when we were taking the patient to the hospital. On the way to the call, it would be the driver up front in the ambulance, and you would have one passenger up front being the other technician with you. On occasion, we would have a third person in the back because we often have students, because we have to do a field internship training during, if you're a new employee here, but also if you're going through, say, paramedic school, you have to do a certain number of hours in what they call the field, which is out in kind of live clinical. We also have other switches and buttons up front that turn all of our lights on. Anytime we're going to a call, we're all using our lights and sirens when we go there. We're going to raise the door, we're going to hit the lights, and we also have what they call a tomar, which will trigger the traffic lights to change in favor of the direction that you're traveling. Once we're in the truck and we're ready to go on the call, we're going to look to the screen, see where we're going, turn the truck on, turn our lights on, which will trigger the traffic tomar, and then we have what we call a hands-free siren. So once I hit the horn, the siren's going to go off like this.
Good morning, my name is Ken Brilliant. I'm the fire chief here at the Brunswick Fire Department. And this morning we'd like to talk about EMS, Emergency Medical Services, here in the town. 80% of the calls that we do at the fire department are emergency medical related. In this region, we don't call them ambulances, we call them rescues. And this morning I'd like to introduce you to Lieutenant Claire Dufort. She's a paramedic, firefighter, and our EMS director. And this morning we'd like to take you on a deeper dive on the inside of one of our rescues. The Brunswick Fire Department has 4 rescues, 2 located at each station in town. We have 40 career members that are all trained as firefighters and EMS providers. Basic level, advanced level, and paramedics. I'll let Lieutenant Dufort go into that a little bit deeper later. But these rescues are a rolling emergency room that are available at any given time throughout the day, 24 hours a day, 7 days a week.
Hi, I am Claire Dufort. I'm a lieutenant here at Brunswick Fire Department, and I'm also the EMS director for the town. What that means as far as being the EMS director is that I'm responsible for ordering supplies and monitoring the level of supplies that we have here in the station, looking at what is available and what I need to acquire, and also if there are any new pieces of equipment that are becoming available to us in the state as EMS providers. I have been a lieutenant for a year here, and I have been the EMS director for, I believe, 15 years. I've been with the department. I'm starting my 18th year this year. I love serving the town, and I really enjoy what I do. I have a great passion for it, and I'm excited to show you more about what we do inside of the back of the ambulance. One of the first things you'll notice when we open up the back of the rescue is that there is this big device in here that looks like a bed. It's called a stretcher. And this is what we put our patients on when we transport them in the ambulance. So I'd like to show you some of the features of this stretcher, as it plays a big role in everybody that we take care of. The stretcher is one of the devices that we use on every single call, and sometimes one of the things that we do is we'll take the stretcher out in order to put the patient onto it, and let me show you how that is done. You release the lock, you're going to pull the stretcher out all of the way. It has a catch. You're going to then lower the feet down and place it on the ground. This stretcher is fully adjustable. It can sit up higher in the back. It can lay down flat if the patient needed to lay flat, and we can get it much closer to the ground if we need to. Welcome on board to tour the back of the rescue, where I'm going to demonstrate to you all the different equipment and some of the capabilities that we have on board of this rolling emergency room. Starting with this cabinet over here, we have what we call our airway supplies. And this could be to take care of a simple need like a patient needing some oxygen, or it could be all the way up through the level of needing to help the patient with their breathing if they're not breathing well, or maybe not breathing at all. We have simple devices like ways to give you some oxygen, and then we have a way to also give a surgical airway. So we build on through very basic needs all the way up through the most invasive and sophisticated needs that you can do pre-hospitally. On this side of the ambulance, we have our bandaging equipment. Again, this could deal with a very simple emergency with a cut where that person needed some simple bandaging care, all the way up through on this side over here in the cabinet. We have tourniquets if anybody had significant blood flow on a limb and they needed to have that stopped, all the way up to a chest seal if we needed to apply a chest seal on a patient that had some trauma to their chest and we didn't want air escaping. Here we have our cardiac monitor, and our cardiac monitor is one of our most used devices on the ambulance. And depending on the type of patient that we have and also the level of care provider that's taking care of that patient depends on how much and to what level this device gets used. It can be used for simple things like checking a pulse and a blood pressure, all the way up through cardiac monitoring, 12-lead EKGs, cardiac pacing, and also defibrillation. If somebody's heart were to stop and they had the correct heart rhythm during that time, we can deliver an electrical shock to help restart that heart. In these drawers below are supplies that help us with that monitor. In this top drawer here, we have what we call 12-lead cables. This is what we attach to stickers on the patient and allow us to perform what we call a cardiac EKG, which is similar to what they would be doing in the emergency room. We have stickers here that attach to the patient. First we snap them into place on this EKG wire and then place them in certain places on their chest to get this reading. We talked about defibrillator pads. We carry those on the ambulance. We carry them in the monitor as well, and those would be for delivering the electrical therapy as needed to the patient if their heart was beating too slow, too fast, or not at all, depending on what the rhythm is. We have another drawer directly below that that holds our IV supplies. Some patients need to have an IV started for delivery of IV fluid and or delivery of medication as well. We have a very same drawer on the other side of the truck with the same supplies in it. So we have different size IV catheters depending on need. If the patient needed a large volume of fluid because they had blood loss from trauma or other reason, we give a larger IV that we can give more fluid over time. This cabinet here is a roll-up cabinet, and one of the important items that's in this roll-up cabinet is our medications. Like I talked about in the IV drawer, where we would start that IV to be able to give you medication if we needed. The medication that you might need is in this box. Down below here is what we call an inside-outside cabinet. We maximize every square inch on this truck for usability. This is one of those cabinets that I can access the equipment if I'm inside of the ambulance or if I'm on the outside. Two of the most important things that are stored in this cabinet are what we call our first in bags. So if the patient was having an emergency in their house and we were going to treat them inside before we brought them to the ambulance, we would take one of these bags inside of the house with us to treat them first. I'm going to show you up close what was in that inside-outside cabinet, and one of those things that's in there is this blue bag. This blue bag is what we call the adult jump kit. This is equipment that we take into pretty much every call that we go on that would involve an adult patient, because we have things in here that are going to help us treat and stabilize that patient before they come to the ambulance. And I'm going to show you what's in some of these different compartments. In this front compartment here, we have our bandaging supplies to treat somebody if they had a cut, a laceration, that type of thing. We have hot packs, instant hot packs. We also have instant cold packs. We have gauze. We have tourniquets. And we have splinting materials also. In the top part of the compartment, we have our vital signs equipment. We have a manual blood pressure cuff. We have trauma shears. And we have also pulse oximetry and a stethoscope. In the lower compartment, we have IV supplies, we have IV fluid, we have airway supplies, again, to manage anybody's airway from basic up through advanced procedures that we might need to do. And let me show you some of that. It's further divided on the inside and organized and checked daily and extensively weekly to make sure that everything is in there that we need. This is our IV kit. In here we have IV needles. We have what we call an Easy IO drill, which is for intraosseous IV access. So the lower level or the less emergent level would be for the IV access, and then if we weren't able to get the IV but the patient was very sick and we needed to, we can access the marrow part of their bone in order to be able to give medications or fluids. This kit is our intubation kit. It has some basic airway supplies as well as some advanced supplies. We have the ability to intubate a patient in the field if they aren't breathing and are unable to protect their own airway, and that's what some of these devices are for. And over here we have what we call an OPA, or oropharyngeal airway, and that can be used by a basic EMT, and that will be utilized in a patient that's not breathing to help keep their airway open and be able to deliver oxygen and breathe for the patient if needed. Not every patient requires that level of care, but we do have the capabilities if needed. We also have what we call a video laryngoscope blade here that has a camera. You'll notice this little mini screen here, similar to these blades to deliver the advanced airway, but it actually shows you a video image of what you're looking at on the screen. What we are going to show you now is what it looks like once we have the patient in the back of the ambulance. In this scenario here, our patient was feeling unwell. We loaded them onto the ambulance and brought them into the back of the rescue. So we're going to demonstrate now what the next steps are going to be that we do on pretty much every single call. And one of those things, like I mentioned earlier, is we always use a cardiac monitor. So I'm going to go ahead and turn that on now, and my partner here is going to apply a blood pressure to the patient. So you're going to have that blood pressure cuff on your arm, Drew, and that's going to puff up really tight just like at the doctor's office, and it can feel a little bit uncomfortable and make your fingers feel a little numb and tingly. Just try not to move your arm. In addition to the blood pressure, I'm going to ask that you put the pulse oximeter on, and then because of the nature of the complaint, we're also going to put him on the cardiac monitor, just like we discussed earlier. The cardiac monitor is going to give us a look at what's going on electrically with the patient's heart. As the chief had mentioned earlier, there are different levels of EMT. So basic EMT can do basic interventions and first care and use an AED. As you advance in your training, to become a basic EMT takes about 6 months worth of training. You have to pass exams and you become certified. Your next level after that is what they call in the state of Maine an advanced EMT. An advanced EMT takes an additional year of training on top of that. The advanced EMT is capable of giving medications beyond the scope of an EMT. They also can start IVs if needed. They can put the patient on a cardiac monitor and do more advanced procedures than the EMT. To become a paramedic, it's an additional year to 2 years of training beyond. And with the paramedic training in the state of Maine is essentially the highest level that you can provide that pre-hospital care. And you can do the things like we mentioned earlier, the intubations, the surgical airways, and giving more medications than even the advanced EMT can give. So what we've done here is we're doing basic vital signs on our patient who had a complaint of abdominal pain. How are you feeling right now?
It still hurts.
Still hurts,
Oh,
I'm
yeah.
sorry. Have you been throwing up at all?
Some nausea, not vomiting, no.
Okay. We put him on an EKG to take a look at his heart, and if I was to see something abnormal on the initial look on the EKG, then I would move and do a 12 lead to do further diagnostics. You can see over here on the screen that you've generated a picture of what his heart looks like electrically on the monitor screen by putting those stickers on his limbs. You'll notice that a piece of paper printed out at the bottom once I had our patient hooked up to the EKG monitor. That is essentially a snapshot in time of what the patient's heart was doing at the time that we put the monitor on them. And then that becomes a part of that patient's record, medical record. What we do also is we take the information, not only is it printed out here for us to see and to give to the providers at the hospital, because we work very closely with obviously the providers at the emergency room, we will also electronically transmit this via Bluetooth or Wi-Fi to a cloud, and then we download it and put it into what we call our patient care report, and it becomes a part of their permanent record, so that anybody needs to access that information in their care team, they can do that via electronic record. I want to demonstrate for you what we can do with the stretcher. If our patient is not doing well and for some reason he becomes unconscious, we can also lay the stretcher completely flat to continue care. You'll notice I have an additional provider in the back with me who is assisting to start care at the beginning of the call. However, if our patient is very critical from either a trauma or a medical standpoint, the provider that is in charge of that call may be calling for additional personnel. Depending on what the level of need is, you may end up with 4 people in the back of the ambulance and 1 person driving up front. When we first get on scene, one of the first things that we're going to do is come to this inside-outside compartment and access whatever jump kit that we need to. We're already going to know via our dispatch information whether we have a pediatric or an adult call, and we're going to grab the according jump kit. This is our adult jump kit as we showed earlier, and it has a couple different ways that we can carry it. One over the shoulder like this and straight into the house. In this compartment here, we have a lot of devices that can help us get a patient out of a tight situation or out of their house and into the ambulance. Again, maximizing every square inch on this truck, we have what we call a reeve sleeve attached to the door. That is a flexible type of stretcher with handles on it that we can place a patient and secure them in and carry them out to the rescue. We also have what we call backboards, which are for an unconscious trauma patient that needs to have their spine immobilized. We may be placing them on one of these devices. These little pins on the side used to have sort of seat belts to strap the patient into place, and this is what we call a head block up top that we would use to secure the patient's head. We also have a stair chair. If we needed to take somebody off of a 2nd or a 3rd floor and they're not able to use their own power, we would use this chair to help carry them out, either under power, our own power, or use the track that's on the back of the tread to slide them down the stairs slowly in controlled manner. We also have cervical collars on here for your trauma patients. They need to have their spine immobilized. We use this to help to secure the neck. In these bags here, we have what we call our backboard straps, or they're like seat belts that go onto that backboard and attach onto the pins, as I mentioned, to secure the patient into place. They have a clip on each end of the strap, and then you're able to cinch the strap down to hold the patient securely in place. As I mentioned, we care for all different types, sizes and ages of patients, so we also have our pediatric collar in case we treated a pediatric patient that needed cervical spine immobilization. This rescue is parked inside of our station right now. You'll notice that it has this hose attached to the side of it. What this is called a Plimo vent. It attaches to the exhaust via a series of magnets that holds it into place. And it helps when we start the truck in the station that it doesn't fill up the station with carbon monoxide, rather it removes the exhaust through the Plimo vent system so we're not breathing in harmful carbon monoxide. It will detach automatically when going on a call. When the truck pulls out of the station, the magnets will detach. And when entering the station, you reattach via the magnets. In order to introduce this next compartment, I wanted to remind you that we are a dual service department and we do more than one service. We don't just provide the ambulance service for the town on the rescue, but we also do the fire side of things as well. What that means is that we're all cross-trained between being firefighters and at least EMTs, advanced EMTs, or paramedics. What that means is we may be on an ambulance call or we may be on an ambulance, but then we end up going to a fire call. So we need to have our gear because we need to be ready at all times. So behind this compartment, you're going to see that I have put my gear in here to demonstrate what that would be like. And typically we would have 2 sets of gear, but I have my jacket and my pants and my boots, also my helmet and my mask. And you'll notice here we have what we call an SCBA, which stands for self-contained breathing apparatus, because we also don't want to be breathing smoke during going into a building that would be on fire. We also have tools that would help us with forcible entry, and we have the axe here, we have a bolt cutter, and we have a Halligan tool. These are all our firefighting tools, but again, being the dual purpose department, we need to be able to be prepared to go on any type of call at any time. So it could be a medical, it could be a trauma, it could be a fire, or it could be a car accident.